Welcome to Medical Sales Live, the #1 resource for breaking into medical sales and building your career.
Today, very pleased to have Dr. Christopher Mickler here with us from Morton Plant Hospital. Dr. Mickler, welcome.
Thank you.
Please tell us a little
Pleasure
bit
to be
about
here.
your background, where you went to school, your residency,
Sure.
and how you ended up at Morton Plant.
Yeah, thanks again for having me, Rich.
Sure.
Let's say I've been practicing neurosurgery for now 13 years. I'm originally from Tampa, Florida. Went to undergraduate up in Chicago at Northwestern University, and then medical school down in Miami area. And then I did my medical school down in Miami, and the residency up in Philadelphia for 7 years. And then being from Tampa, was always a sort of a desire of me to come back home. And so in 2009, I got a job through in a private practice at the time with a couple of the neurosurgeons who I had known for a while. And then I've been in that practice since.
Perfect. Yeah. Fantastic.
Yeah.
So I thought we'd start with a little bit about reps in your OR room and
Sure.
what you like, what you don't. What kind of skill set are you looking for and strengths that you think make them successful
Sure.
to be part of your team?
Well, I mean, I think neurosurgery itself is a pretty demanding profession, both from a physician standpoint and an ancillary standpoint. But I think dedication to the job and just knowledge going into it, especially when you're in a surgical field, is extremely important. There's a lot of demand on reps, medical device reps in the neurosurgical field, and that trickles down to family. That can trickle down to weekends. Unfortunately, we're not able to predict when we need to do surgery, and therefore we're not able to predict when we need device reps in the OR with us. So, it's a very rewarding field, but it's also very demanding in terms of commitment.
What percentage of your time is elective versus trauma,
Sure.
emergency type surgery, and do you always have a rep in the room during that all times, including, I'll say, on-call times?
Right.
3 in the morning?
Right. So, fortunately in the spine world, the traumatic aspect or emergent aspect of spine surgery isn't something where you necessarily need to be in the OR within an hour, like it is when you're talking about cranial surgery. If someone's had a stroke or a large brain tumor, that requires more of a time urgency. But most of the time when someone comes in that is going to require operative intervention, generally it's about a 6-hour window that I can inform the rep to know that I'll need them that day.
And what kind of clinical competency are you looking for out of the rep? What is your expectation of a good rep?
Yeah.
And your definition of that can help you and your team get through a given case or get through a given day?
Yeah, and forgive me, you'd ask about the elective aspect of practice, and I'll get to that in a second, but I'd say about 70% of my practice is elective with respect to spine surgery. So the other 30% is cranial, and again, that is somewhat elective in itself, but for the most part, the reps have a really good knowledge of when they're going to be needed, and they have ample time to do that. I think your question was
on the competency of the rep.
Yeah.
What makes a good rep from a bad rep?
Sure.
What are the things that annoy you, or obviously can make a case go much smoother, or becomes much more challenging day?
Right.
If they do their job well versus not.
So I think that for me and in my practice, being a good rep, it all has to do with trust and knowledge that they are committed to the job. Just like I have to be committed to my job, and the hospital has to trust what I do and the decisions I make, the same thing applies to a rep in a company. And as you gain trust in that individual, their responsibility becomes larger, to the point where in my operating room, the rep who I use will be measuring off sizes from a bone perspective. So I'll know what size screw necessarily I have to use, and for example, what type of hardware I'd put in the disc space if I'm doing a fusion, size of plates, etc. And I trust that individual because I have other stuff going on in the OR as well, that they're able to help me. So trust, dependency, those are extremely two important things.
So from your perspective, the rep, is part of your team.
Absolutely.
I mean, they're just not somebody in there opening a box, from time to time. They could be involved in the pre-op planning.
Yes.
Not necessarily the post-op care, but certainly making your team, they're a team member within the hospital.
Oh, 100%. I mean, I think that, one of the things that I talk to my rep about in the OR is, when he goes into the operating room, this patient is under drapes and, he doesn't really see a lot, but these are actual individuals and human beings. And so I make it a point to take them on rounds at times after surgery the next day, just to see, well, this is so-and-so, Mrs. X, this is actually how she's doing, why we did what we did, let the patient say, am I feeling better, doc? I'm ready to go home. So it sort of impacts the rep to know that it's more than just a run-of-the-mill case in the operating room. These are real human beings you're operating on. So, it's almost a family. I mean, you have the nursing staff, you have the anesthesia staff, you have the surgeon, you have the scrub tech, and then you have the rep. And it's important for that rep to be able to speak up in the operating room, to talk to the scrub tech, have a good relationship with them in terms of, how to load an instrument, how to, different, because the scrub techs go through, 10 different companies in a week. So everything's a little different.
Very good. And last question on the rep side of things. What are some examples of things that they should and should not do inside an operating room?
Well, I think it has to do with their comfort level with the surgeon, and that goes back to, that sense of family and trust. When you're first starting out, I think it's important to be sort of on your toes a little bit in terms of not stepping over bounds, not talking up in the middle of an important aspect of surgery. That certainly can provide some annoyance as a surgeon. But, as the months go on and as the years go on as a surgeon, you become more comfortable with a certain representative in the OR. And therefore, if I'm doing a case and, perhaps I'm angling at a certain angle, then I feel very comfortable with someone telling me, why don't you think about this or try that? It's a sense of, in my operating room at least, speak up when you feel something's important to speak up. And don't, you'll know in the middle of the surgery when there's an important aspect of the case or stress has sort of reached a higher point, not to say much.
Time to leave the room, perhaps.
Perhaps, yeah. Sometimes that's happened.
Be sure to check back for part 2 of our conversation with Dr. Mickler as he discusses the latest in product innovation and surgical techniques in neurosurgery and spine care. And as always, be sure to subscribe to this channel for all things medical sales.